Action.
Go.
Hey, babe, welcome back.
Hi.
Yeah, IB Radio. I think this is episode 3.
Yep.
And we had a question on one of our first podcasts, I think the one that I did with Claire, and it's about moving past weaknesses and speaking about injuries. And in my head, I'm like rephrasing it as moving past your excuses and then working with injuries.
But it started off with, the question was about excuses people give to training. And one of those excuses, the final one was, oh, if I've got X issue, that means I can't train, I can't do anything about it, it is what it is.
Yeah. But then we have other people, and it's the common fitness hurdles of, I've got no time, I don't have the motivation, or I'm injured, I've got a sore back, my knees hurt, shoulder, elbow.
Shit.
Okay, as a woman, I am going to say, in terms of time, we're tired. Like, come on. I understand it. And it's a lot. So to have the mental energy to then want to do something, I think that is what we get stuck with. And it's like, we do have the time because we're spending that time sat on the sofa after a day of working or scrolling on the phone.
So this is my response when I get that question, right? And I'm going to give it to you because I've never asked you this question, right?
Yep.
So you've got a job and your job requires you to be at work at 8 a.m. So you know
8 a.m?
Yeah, 8 a.m. Be a luxury, wouldn't it?
Yeah.
Right? So you know with your morning routine, you've got to get up at 6:30 so you can get ready so that you can then go to work, right?
Yeah.
Your boss turns around to you and goes, right, okay, we're going to have to change your hours. I need you to come in at 7. Your job's safe. It's just we're changing our shift pattern. So that means from tomorrow, instead of 6:30, you've got to get up at 5:30. Are you going to tell him you're not going to do it, or are you going to find the time to do it?
No, you just do it.
Why?
Because it's my job.
And why is your job important?
Because otherwise I don't have a job and I don't have no money.
Okay, so if I told you your health was important so that you can live longer, and I'm asking you to give an hour of your time to go to the gym, and you're going to me, I don't have the time. Like, well, you've just proven that you do, because you've just given yourself an extra hour because you have the belief that you have to do it, right? So when people give me that I don't have time, that's normally my first go-to. Is like, well, if your job dictated that you had to change your hours, you had to get up an hour early, you could, so you can. Then it's, okay, well then let's look at your Netflix feed. Let's look at your Spotify feed. Let's look at your Instagram feed. And how much are you wasting on that? There we go. People then try and use the valid excuse of, well, it's downtime to switch off because my life is stressful and yada, yada, yada. And it's like, okay, but going to the gym is one of the best stress relievers you can get. So it's, the issue is people are creatures of comfort and creatures of habit, and trying to disrupt it without a strong enough anchor is always going to be difficult. So it's, for most people that are going, oh, I haven't got time, I haven't got this, that and the other, it's like, no, what you have got is an abundance of excuses to not make those changes. But then it's, why do you need to make that change? That's where it comes down to, I suppose.
Yeah. And I think for me, you hit it when you said, like, I need to switch off. You're doing those things to switch off. For me, the question is always, what are you switching off from? And it is that you are making the excuses because you're either mentally drained from the day, whether that is work, but then why are you in a job that is mentally draining you or taking so much from you? And they are excuses. So then the question becomes, how do you move past those excuses? Because we do like the comfort zone. We do want to just get home, sort the kids out, do the dinner, clean the house, have time for us. Going to the gym is one extra thing for a lot of people to think about doing. And then you've got the added fear of they have to go to the gym. They have to step through the door. And it's that spiral of, well, now you've got anxiety about doing something new, stepping out your comfort zone. So how do people move past those excuses? Because you're right at the beginning, they're excuses. You gave a valid point about, well, if it was your job and your job depended on you getting up earlier because you've got to be there an hour earlier, why do we not all take the same approach to, I'm the most important thing in this world as a person in my life because it's your life, but everything else takes something from you. Why don't we give that time to ourselves first and then go, actually, no, I can't come into work an hour earlier because my routine is I get up, I have an hour for myself, and then I go to work.
Yeah, but you've kind of gone another level deeper above the point I was trying to make, is that if you're in a situation where it was like, well, you need to change it, you would. And the point is, most people are sitting there, they need to do something about their health, because yeah, it's great in your 20s and your 30s and you feel okay, but it's when you hit your late 30s, 40s and all the problems start creeping in, it's okay, you have to do something about it. And like you touched on it a minute ago when you talked about what are we trying to switch off from? What are we trying to get away from? What is the stress and the problems?
Life.
And it's that like, you know, you said like, and then the most common one for a lot of people is their job. And I've heard you have this conversation with people, and I've had it where we've said to people, change your job. Like if your job is that horrible, that stressful, get a new job. Like it's not the end of the world, but people can't because there's that fear of change.
They can, they
and
just won't.
Exactly. And that is the issue when it comes to fitness, whether it is focusing on cleaning up your diet or if it is going, right, okay, well, I need to spend 30 minutes in the gym 3 times a week. It's trying to change your mentality around its priority. It's something you're doing for you as a hobby for most people, but it's not. It's something you're doing so that you can stay around longer. It's like it is a high priority that people view as a luxury time rather than a required time. But those same people will then spend 3 hours each night binging Netflix. Yeah. And I'm like, you've got to fix those priorities.
Would you say the answer to overcome or to move past your excuses in life and to make yourself a priority and to do things that do take care of your health and reduce pain or whatever is to actually take a look at your life, look at the excuses you're making and have a good, honest conversation? Because you have to be honest. You're avoiding all the uncomfortable shit because you prefer just going home, sitting down, doing nothing, but that's not going to help you.
I think, yeah, so it's that. And there seems to be like how do I word this? It's like, I've called it the ostrich approach, head in the sand. You know that your health is going to be a problem further down the line, but because it's not a problem today, right now, I won't worry about it. And there comes a tipping point. Same as like, you know, people that go, oh, I'm in my overdraft. It's okay. I'm only in it a little bit. It's fine. Until they get to the point where it's like, actually, now I'm in debt and I'm screwed. Now I can't. You've gone past the point of no return. And the trouble is people get too easy going, it's down the line. I don't need to worry about it right now. And it's like, no, you do need to worry about it right now. So that end of the line never comes. And I think for a lot of people, they don't view health and fitness in the reality that it should be viewed in. They need to understand the importance of it. But because you feel okay right now, because you don't feel ill, because you can move around, because you're not on loads of medication, you don't care. But you will when you get to a later point and all of a sudden I'm in pain constantly. I'm having to live in a bungalow because I can't go up and down stairs. I'm having to pop pills 3 times a day. And I'm actually actively losing time. And it's the trouble is people can't prioritize it now. They can't look ahead into the future and go, actually, that's what I'm going towards. And it does blow my mind that people will willingly go, oh, it's all right, it's fine, don't worry about it. And I'm just like, you can't do that. You can't do it's almost like the other analogy, it's like the Saturday night Saturday night Dina that's out on the piss doesn't have to worry about hangover Dina tomorrow morning. That's her problem. And then you wake up with your hangover and then life's miserable, right? Well, people do that with their health and fitness. They go, oh, that's a problem for 70-year-old Hayden. I'll let him worry about it. And then when you're 70-year-old Hayden going, everything hurts, I'm on loads of medication. No, you've just ruined your quality of life. But people won't make that priority. And it's not like you have to make massive changes to your life to avoid that from happening. Literally eat a little bit healthier, move a little bit more, park further away in the car park, take the stairs instead of the lift, go to the gym for 30 minutes every other day. We're not asking you to live in the gym for 2 hours every single day and live off of rabbit food, but people aren't willing to make those changes. But the ones that do, then actually go, actually, this is quite enjoyable. And then they start making bigger and bigger changes and it changes their life. And it literally improves your life. But you have to be willing to step out of that comfort zone to do that. Yeah. But to do that, you have to have the anchor of why is this important? If you're just doing it because we're telling you to, you're not going to change it. You have to go, right, well, why is this important to me? What is the value to me? And understand that value isn't necessarily going to be value tomorrow. It's the value of, well, when you're 60 and your grandkids are asking you to play, you're not going, sorry, kids, I can't do it because I can't stand up. You can have a better quality of life. And it's just trying to frame that through to people, which I think is the difficult part.
Yeah, it's understanding that if you don't do the work now, you're going to have to suffer in the future or do the work then. It's still going to be a choice you're going to have to face because you're going to be ill, you're going to be overweight, you're going to have diabetes, you're going to have heart disease if you don't start taking care of your health. And if you don't start moving, you are going to hurt once you get over 40. It is not, you know, it is a bit of a joke. You will wake up after 30 and it is downhill, but if you can move, lift weights, then it does get a little bit easier. And I think that brings us nicely into the next point of, should we just accept that at some point in life you are going to be in pain, you are going to hurt, you are going to get injured, and it is what it is, and there's nothing you can do about it?
Absolutely not. Absolutely not. Like, unless medically you've been told, like, you have this condition, you know, I suppose in some degrees, people that have like high levels of fibromyalgia and stuff like that, where it's like, this is something that's attacking your system. You can, even those people that go, oh, I've got this, I'm like, that's rubbish. Like, you still can avoid and reduce the damage that it's doing. But it's very, 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 very rare that you're going to be told you need to not do nothing. Because the cure for most things is movement. Like, unfortunately, that's the reality. It's not more drugs, it's movement and using your body properly. And yes, as you age, things get harder. I'm not going to lie about that, but you can still mitigate that by regular movement. Like, there's plenty of people we have here that are in their 50s, 60s, 70s that are still training, and they're still training well because they do it consistently. Like, you know, most yoga classes you go to are full of all older people. And it's low intensity, but it's great movement. It's muscular training and endurance. So yeah, it's harder, but it's also a very vital point. Like, you have to do it. Like, you can't use being older as being an excuse not to do it.
No, and I think it's important for everybody to understand that pain is not necessarily something or a reason for you to not do something. It's a message for you to do something different, because pain is usually because you're being lazy. You've not moved your body in those ways. You've been sat in a chair for 8, 12 hours. You're driving, you're sitting at home. You're not moving your body. And I think that's where a lot of joint pain can happen. And in terms of, like, you know, common ones, the back, the shoulder, knees.
Well, if we use me as an example, I've got rheumatoid arthritis and osteoarthritis. Like, if I listen to my body for 50, 60% of the year, I wouldn't move. But the reality is, once I start moving, yes, don't get me wrong, as you've seen, I have the bad days where I'm bedridden, but there's other days where it hurts. But once I get moving, once I start doing stuff, it helps. Now, obviously, there's a big difference between, oh, I've tore my ACL, I've tore my Achilles, I'm in pain. Yeah, okay. Obviously, we're not going to say, well, just suck it up and do some squats. There's certain things that you have to rehab, but rehabilitation requires movement. Like, there is no rehab program that is stay still, do nothing. And it's, you know, it's understanding where's your barrier for movement, and then what can we do to fix it. And 9 times out of 10, improving movement and improving your exposure to that type of stress will fix and eliminate those problems. It's just a fact.
I think one thing, again, I work with clients that are in pain, but it's not always pain because of physical injury. It's nervous system pain. It is because they're in such a stressful state of mind. And it is a state of mind because you're just thinking of everything else, everything, you know, you're 100 miles an hour, always on the go. Emotional pain. You mentioned fibromyalgia. That is a blanket thing for a doctor doesn't know why you've got pain, so we're just going to label you with that. But a lot of those people have underlying emotional reasons which manifests physically. In terms of physical pain, like back pain, osteoarthritis, my back's always hurting, doesn't stop me lifting. If I do nothing, the pain is more severe. And I think a lot of people are just, you're accepting that if you get to a certain age, you're going to be in pain, and then you're not seeking the help you should be getting, but you'll go to a doctor and get medication. And I think, one, it's important not to think you need to push through pain, but you need to be honest about what's going on in your life, what movement are you doing, and then if you have got an injury like you mentioned, ACL tear, why did that happen? Is that something that was going on? Because that's the knee, for anybody that doesn't know, it's a ligament inside the knee joint. A lot of people do get knee pain, but it all manifests from the foot, the ankle, the hip. Something else is going on in your body, and the joints that are stuck in the middle are going to take the impact. My elbow is a prime example. So it's like, how do you get those people to say, because that, you know, mentally, it brings me down. I don't want to work out. One, because I'm protecting it, but then I am going to push through because I'm stubborn and I don't want it to stop me doing what I want to do. But then there's a fine line between your body's actually giving you a signal for you to listen to. A doctor's not going to fix it, but you have to understand what's actually going on and causing that pain.
Yeah, but again, if we expand on your example of you and your elbow, yeah, it stopped you this week from training properly, but what have you also done? You've reached out to your physio to go, can we have a look at this to try and diagnose what's going on? You have your NKT treatments. And again, you're not just accepting, well, that hurts, that's it. You're going, okay, well, there's some days I can't do stuff, but I need to figure out what is actually going on so I can now fix this problem, which is what you're doing, which is what most people don't do. You know, a lot of people's problems come down to what they're doing most of their day.
Or not.
Yeah, or not. And we're doing it now. We're sat in a chair. Like, we're not designed to sit like this. Yet people will spend 10 hours a day sat at a desk, and then they're sat in their cars and they're slouched on the sofa, and everybody's in this bad posture, and they go, oh, my back hurts, my knees hurt. It's like, well, yeah, because you're holding yourself in these positions we're not supposed to be in. Guess what the cure is? Movement and use. So, you know, spending 5-10 minutes a day of doing mobility, and it's as simple as that. 5 to 10 minutes a day of mobility drills in the morning and then at night when you get home. You don't have to do lots, but you need to do something. You can't just do nothing. Doing nothing's never the answer. Like, for any problem, doing nothing is never the answer. You've got to do something. Yeah. But it's having that accountability of, why am I doing it? And I think, to sort of steal a little bit from a point you mentioned earlier, people don't appreciate, again, how I word this to people is we have 3 buckets: physical, mental, emotional. And we can only fill those buckets so far. You can't have all 3 buckets filled to the brim and expect to function.
Try.
We will try. And our coping mechanism normally is drink, drugs, entertainment, something else takes us away from it. Food. But people really vastly underestimate how much stress is stress, and all 3 of those are stress. So you may not be going to the gym much, but if you've got a job that you hate because it's super high stress, and then at home, you know, your home life's falling apart, you're arguing with your partner all the while, you're overfilling those 2 buckets. Like, you need to take some of the volume from those 2 and move it into the movement to balance them back out. But you also have to address the mental and the emotional. And this is something that we preach a lot to people. It's not just a case of, yeah, come join the gym, just move. It's like, okay, look at your life. Yeah. And it's the hard part that no one wants to do. And again, we've been through this, like with my therapy and stuff. It's like, you have to put yourself in that position to actually look at these things and actually make a change, rather than just accepting and going, well, life's just stressful, that's it. It's like, it's stressful because you're allowing it to be stressful because you're staying in that boat. Like, get in a different boat. And
your body's in pain because you're accepting it as, that's it for now. I'm always going to be in pain. So ultimately, reach out to a professional and say, look, this is what I'm struggling with. How can I change it? Because we're the ones that are going to have a look at those 3 buckets and question what the hell is going on in your life. What are you doing to mitigate it?
What I was supposed to say, and I forgot, sorry, is that when your mental and emotional stress buckets are over full, it will leak into the physical, and you'll start to feel physical pain. You'll hold tension in places because you're stressed. That will then cause the physical pain. So 9 times out of 10, when you have physical pain, it's because you're overloaded in the mental and the emotional. So you have to look at it as a whole rather than just one element, which is just move, if that makes sense.
Yeah, of course it does. And to wrap that up, I think ultimately is never just think, this is my life, this is it, I'm just going to be like this, I coming up with all these excuses, I'm going to be in pain. It is reach out and get the help you need. Yeah. And a GP is not the one to do it. That's what we're here for. So
unfortunately, people need to be aware that trying to book in with your doctor is, unless you are actually ill, never bother. My personal experience, 12, 13, 14 years ago, I ripped my shoulder out, and I went to the hospital, had an x-ray. They were like, right, we're going to book you in with our physio. I waited 2 months for the letter from the physio. It was then another 5 weeks till I had my appointment. In that meantime, I'd already been to a physio, started my physiotherapy. I went to my hospital physio appointment, and they went, right, without even looking at me, they went, right, cool, we can see from your x-ray, this is what the damage that you've got. These are the exercises I want you to do. And I was like, okay, well, I've already done all those. This is where I'm at now. Okay, well, this is only a stage 1 appointment. You've got to wait for the next one. And it's like, if I'd not gone ahead and gone to a physio, I would have gone nearly 3-4 months before I would have had any support, and it would have been too late. you need to go to actual physical therapist-based people to look and go, right, this is where you actually are. This is what you need to do. But most importantly, if they tell you to do stuff, actually do it. I can't tell you the amount of people that have come to me with injuries and niggles. And when they go, yeah, I've seen a physio, they gave me the exercise to do daily. And I go, have you been doing them? No. It's like, well, what do you think is going to happen? That because you've got the sheet of paper that it's magically going to happen? So yeah, if you have physical issues, again, blowing our trumpet, come to us because we can assess where that is. Because 9 times out of 10, it probably is a mobility issue rather than an actual physical issue. And it's just you're using it wrong. But we also know the right people that we can go, okay, we think you should go speak to this person because they're going to be able to investigate that. And then it's finding the right path to move forward for them. It's not just avoiding it. You can't put your head in the sand and go, well, it's injured. It's pain. It is what it is. Because 9 times out of 10, that's not the answer.
Yeah. And I think I'm going to wrap that up with take responsibility for your life because it depends on it.
That's a whole other podcast that we can literally go into for definite.
Yeah. Amazing. Thanks, babe.
That's all right.
Cheers.
Toodaloo.
Bye.